to Nigerians about the reality of COVID-19 and the fact that it's not a thing that you can take lightly. The PTF is working to develop new health protection regulations to support existing COVID-19 protocols and to strengthen compliance with non-pharmaceutical interventions across the country. We've issued protocols, but we are going a step further to develop health protection regulations that would have application across the country. It has become embarrassing to note that some Nigerians continue to present fake results when traveling outside the shores of this country. Not only is it a risky thing to do, but also puts our country in a very bad light. This remains a major source of concern to the federal government, and the PTF has directed private laboratories to immediately put in place measures to validate results and ensure that all passengers are registered on the travel portal before samples are being processed to stop this very unwholesome activity. The national coordinator would elaborate on this during this press briefing, because we have to take steps to ensure that these criminal acts are not further perpetuated. The Presidential Task Force is aware that the world is at a critical phase of infections. We are constantly reviewing our strategy to emerging situations, especially in risk communication, vaccine hesitancy, fake news, and disinformation. And this is where the media has a big role to play, because you are the conduit through which we reach out to the Nigerian people. In your editorials, in your commentaries, the messaging should be positive, and Nigerians should be encouraged to comply with the MPIs as we anticipate the arrival of vaccines on the shores of our country very soon, and to give the correct perspective, the correct information about the vaccines, their efficacy and effectiveness, so that, like I said, vaccines will not be resisted when they are available. We call on the general public to remain focused on the drive to reduce the level of infection and make our country safe again. We urge the subnationals to enforce relevant measures that will help to curb the effect of this virus on our lives and livelihood. Some of us will be meeting tonight with the subcommittee of the National Economic Council, having a membership of governors from across the 6 geopolitical zones, chaired by the governor of Delta State, to further discuss the protocols and the health regulations that we are working on, health protection regulations that we are working on, and to look at the aspects of enforcement across the states of the Federation, and the need also to ramp up testing, open up the isolation centers to enable the subnationalities provide care for hundreds of our people that are getting infected on a daily basis. I now have the privilege and honor to invite the Director's Hospital Services of the Federal Ministry of Health, representing the Honorable Minister, a director from the NCDC representing the DG of the SCDC, and the national coordinator to brief you on and from the technical perspectives. And thereafter, if there are any further updates from our ministers, you will take that, and thereafter we will be available to take your questions. I thank you all for listening and wish you a great evening. Thank you.
The chairman of PTF and the secretary to the government of the Federation, honorable ministers present, please permit me to stand on the well-established protocol by the SGF himself, even as I appreciate this honor of representing the Honorable Minister of Health to present the Federal Ministry of Health briefing to this august gathering. As of yesterday, the 6th of January 2021, new cases recorded were 1,354 with one death, unfortunately. The total number of cases tested is 1,004,915, while the number of confirmed cases is 94,369. Active cases stand at 15,764, and the discharge cases till date are 77,299. The number of deaths till date is 1,324, with a case fatality of 1.4%. The federal government is determined to ensure morbidity due to COVID-19 is reduced to the barest minimum, while improving on the fatality rate. Appropriate measures are being taken to achieve these objectives. Please recall that the SGF himself already informed the Nigerian populace that the federal government has approved the establishment of new oxygen plants across the country. This is in a bid to ensure that the case management, especially the critical care, is optimized. In addition to this, the Federal Ministry of Health continues to build the capacity of the critical care health workforce, particularly the intensivists and the biomedical engineers. As a second phase assessment of our isolation and treatment centers, we will be conducting verification of the challenges experienced by the centers shortly. This is to enable us provide appropriate intervention measures required to strengthen the isolation and treatment centers. We are not unmindful of our obligations to our health workers, particularly those in the front line. We appreciate them and urge Nigerians to encourage them in this challenging pandemic situation so that they can continue to give their best. We're also working very hard to get vaccines to our people. It may not come soon enough, therefore we need to be alive to get the vaccines when they come. The honorable ministers have brought this up to underscore the importance of compliance with non-pharmaceutical measures as advised to reduce transmissibility of the virus. We continue to appeal to the states to increased testing and contact tracing. The cooperation of the states with the federal authorities is critical to our collective objective of defeating COVID-19. I thank you for listening.
Good evening, Chairman, sir, Honorable Ministers, NC, and good evening, ladies and gentlemen, gentlemen of the press and gentle ladies of the press. Good evening. So today, I'm representing the DG and CDC, and we have talked more about the number of new cases that are rising. It is alarming, and we need to be very careful. Over the last week, we have done over 40,000 tests, and we have increased the national testing. That is, we need to increase the national testing, and that's the only way we can understand the burden of the disease, particularly now that we are recording very high cases. Since the outbreak, we have actually all worked tirelessly to try as much as possible to reduce transmission, including our gentlemen of the press, giving out information, the right information. But then we also need to do more. The reality of the increasing transmission, the positivity rate, the test positivity rate, and confirmed number of confirmed cases remain a cause for concern in this second wave that we are into. There's therefore need for us to strictly adhere to the non-pharmaceutical interventions, and that is the proper wearing of our mask. I always say that it's not called chin mask, and it's not called under the nose mask. It is face mask, and that means we need to cover our nose and mouth. So we need to take this out and encourage those that are not wearing it well to put it on properly. We also need to do hand washing and maintain the physical distance. So at the NCDC, we have continued to, throughout the holidays, we have continued to work. Some of our colleagues were not able to even go for the holiday to meet with their loved ones. Our national EOC had been on throughout the year, throughout the pandemic. Now we're having increasing infection in the health workers. And so we're appealing to our health workers not to let their guards down, to make sure that they adhere to the infection prevention and control measures that are in place in their facilities, and so as to prevent themselves from getting infected. In the last week, we have distributed actually IPC supplies to all the health facilities, the relevant health facilities, and also to the state. So we have enough of that at the health facilities. So they should not take unnecessary risk. We will also continue to support the NYSC. The stream 3 is starting very soon. So we'll support them and make sure that we test the core members before they go into the camp. Now, following the successful use of the RDT that we used during the NYSC campaign, we also have plans to roll out the RDT to the hospitals, especially the general and tertiary hospitals, to enable health workers and patients in line with, to test health workers and patients in line with our guidelines on the use of the RDT. We have also intensified risk communication activities. We've engaged media colleagues. We've aired a lot of jingles. But our data is showing the majority of the cases recorded are between the ages of 21 to 50. And this poses a lot of risk to the elderly, because majority of the young ones, we have a high percentage of young ones amongst us, very active, but then they have the elderly at home that they visit. During this holiday, I'm sure most of us went home to see our grandmothers, our grandfathers. And so, in the process, if we were careless, we would have transmitted this virus to them. And they are not that strong. Their immunity is not that strong to be able to withstand the virus, So I think we need, as a population, to advise our young ones to please adhere to the non-pharmaceutical interventions. We have seen where lots of
not only manage this epidemic, but to also make sure that we are able to keep on top of our health system and to save lives. We are seeing an increased number of new infections in the country, and this is having an impact on our health systems already. And when it comes to mortality, it's not just those that die from COVID, it's also those that have other health conditions that may not be able to access health services, partly because the hospitals are overcrowded with patients with COVID. So I would like to reiterate parts of the protocol that continue to be in place, just for clarity's sake, so that the public will be aware. The nationwide curfew of 12 midnight to 4 a.m. remains. The wearing of face masks in public is still mandatory, particularly the implementation of the no face mask, no entry, and the no face mask, no service for all government and commercial premises. As stated by the chairman, we are working on a new set of health protection regulations that will support the Quarantine Act, and hopefully will help us to strengthen the compliance with non-pharmaceutical interventions. When it comes to mass gatherings, a restriction is we're still restricting to no more than 50 persons, unless for religious activities where we strongly recommend not more than 50% capacity in a building, and preferably outdoors rather than indoors. For travel protocols, just to let you know that we have tightened up on international travel protocols, and from Monday the 11th of January, the PCR validity, the tests that people present outside the country that has to be negative for COVID-19, the time frame has been shortened from 120 hours to 96 hours, or 4 days, in order for us to fit in with other international requirements that are currently in place for a lot of countries. In terms of the other restrictions, just to remind you that government staff, grade level 12 and below, particularly the federal staff, should continue to work from home. limitation of government meetings to virtual while maintaining restrictions on physical meetings. So if you're a government official, unless you really have to, please stay put and work from your base. We continue to have temporary restrictions on recreational venues, gyms and sports facilities until the 25th of January. And just to remind you that event centers, bars and nightclubs must remain closed. And we're grateful to those state governments that continue to enforce this across the board. So, in terms of other issues, the PTF will specifically like to note the fact that our health system is currently strained. We understand the pressure that our health workers are currently undergoing. Clearly, they are getting overwhelmed. And these are our last line of defense when it comes to containing this pandemic. So for that reason, we will commend our health and frontline workers for their sacrifice and tireless efforts in caring for the sick, and the government is committed to ensuring that they have all they need in order to protect themselves and to mitigate the impact of the virus. In terms of, again, the issue of fake results, as the chairman mentioned, we are putting in place measures to stop this from happening. For people exiting the country, first of all, not every country requires a COVID-19 PCR test. So please check with your airline and check with the embassy of the country you're visiting. Do not check with touts. If you check with a tout and ask whether or not you need a COVID PCR test, they're likely to say yes, aren't they? So check and make sure that a COVID PCR test is required before you go around trying to get it. Do not waste your money on a COVID PCR test if it is not required for the country you're traveling. And the majority of countries in the world still don't require a test. If you do need a test, please do not buy a fake result because it's criminal. We're putting in place processes. We will let you know by next week. We will have a fixed date beyond which, if you need a test, you have to go through the travel portal. You have to enter your details, print out a QR code, pay for the test, and in order to print out the QR code, by the way, you have to pay for the test, and you can pay directly to the accredited laboratories. You then get your sample taken. When your result comes out, it will reflect the QR code you have. And in future, in the next few days to weeks, we will make sure that every result presented at the airport has a QR code number that matches what we have on the travel portal. So that would stop the fake results issues from recurring, because you will not be able to print out the QR code unless you have gone onto the travel portal. And those links have to be there. The two documents will have to link. If they don't link, you will not be able to travel out of the country, because it's causing tremendous embarrassment to our country. In terms of vaccine, I'm sure you may have questions for the Executive Director of the Primary Healthcare Development Agency, but just want to inform you that we are rolling out a vaccine awareness campaign with the agency, and this is really to equip the public with the needed information required to trust and accept the vaccine, as well as to deal with the substantial amount of misinformation that is out there with regards to vaccination, COVID-19 vaccination. In terms of testing, we congratulate 4 states for achieving 1% of their testing target. FCT is way ahead. FCT, as at the 3rd of January, has tested 3.56% of their population. Our target was 1 to 2% of the population. Lagos has achieved 1.5% of the population. tested, Rivers 1.2%, and Plateau State 1.04%. The reason why we're interested in testing is if you have a problem, you need to know that you have a problem, and you need to know where it is. Without testing, you wouldn't know. The only way you'd know it would be when your hospitals start getting filled up and people start dying. So for that reason, we continue to thank state governments for working with us. We had a meeting of the Honorable Commissioners of Health throughout the country today. We have strategized with regards to ramping up testing across the country. As I said on the last time we met, even though we are testing a lot more, last week we tested 37,000 samples, but 3 states, 37,000 samples in a week, but 3 states tested only 6, 11, and 26 samples for the entire week. Very little. And even though we've now crossed the 1 millionth test in the public sector, there are states that have tested less than 500 of this since we started the epidemic. So we're still grossly under-testing, and this is reflected, of course, in the number of persons we are getting going into the hospitals versus what we actually have on the ground. I think there's a lot of transmission going on in the communities. So we have now at least 69 public health molecular laboratories across the states, and we urge the states to continue to work with us. Those states that have problems with their laboratories, we're very much aware. Those that have issues with test kits or extraction kits, we've taken it up with NCDC, and we will work with you towards making sure that that anybody who requires a test for COVID is able to get it done free of charge unless you are traveling. So let us all please play our part. Thank you.
For the benefit of our listeners at home who have been following this program, first, after the chairman of PTF, you heard the voice of Dr. Adebi, who represented the Honorable Minister of Health. She is Director of Hospital Services, Federal Minister of Health. Then we had Mrs. Elsie Ilori, Director, Surveillance and Epidemiology, Nigeria Center for Disease Control. She represented the DGNCDC. The NCPTF, Dr. Sani Aliu, has just concluded. Well, for the benefit of reaching a segment of those following this program, please permit me to now invite the Honorable Minister of Environment to now reach that segment. Honorable Minister, please.
Mr. Chairman, members of PTF, gentlemen of the press, good evening. From the Federal Minister of Environment, we have been engaged in continuous advocacy, seeing the situation that we are facing. The numbers are rising. They have stated that. The Minister of Health, NCDC, and the NC, I will not repeat that. I will simply just summarize some of the issues discussed in Hausa. Jama'a, assalamu alaikum. Muna ƙara ci gaba da maimaici da tishi akan halin da muka samu kanmu na wannan annobar corona din. Waɗanda suke sa kunne su ji labaran duniya ko a rediyo ko a talabijin za su ji cewa wannan cutar tana ƙara yaduwa. Me yasa? Saboda rashin bin ƙa'idojin da aka gindaya. An faɗa ana kuma ci gaba da faɗi. Idan ba mu ba, za ta ci gaba da yaduwa. Rashin bin ƙa'idojin yana ƙara mata ƙaimi ne wajen ƙaruwa da addaban jama'a. Bayan na faɗi abin da ya faru shekara 100 da suka wuce, shi yake faruwa yanzu. Kada ya zamana mun san abin da ya faru baya kuma ba mu yi amfani da wannan ilimin ba. Mu ci gaba da yin wani abu da zai ci gaba da zama mana bala'i. Idan fa ba mu yi ba, to za mu ci gaba da ganin waɗannan adadin mutanen da ke kamuwa a kullum yana karuwa. A jiya, kamar yadda sakataren gwamnati ya faɗa, waɗanda suka kamu mutum 1,664. Wannan ya ninka waɗanda aka samu a rana guda tashin farko da ta shigo. A lokacin mutum 790 ne muka taɓa samu, kuma lokacin muna kururuwa yayi yawa. To yau an ninka saboda rashin bin ka'ida. Ina so mutane su sani, mun faɗa muna ƙara faɗe da gaske ne, kuma wannan karan tana fa kama kowa ne. Da kaman ta fi kama dattawa da sauransu, to yanzu tana kama kowa. A nan an faɗa kun ji daga 'yan shekara 20, shekara 10 ƙasa da haka sun kama da cutar nan, ana kuma kan kamuwa. Har a yanzu babu wani takamaimai tabbataccen magani da za a ce za ka sha shi ka warke. Ana samu, ana warkewa ɗin, amma ka sani idan kana cikin wanda in sun kafa za su warke? Baka sani ba. Saboda haka bin ka'idan shi ne mafi sauƙi, mafi a'ala a gare ka da waɗanda kake so da kuma sauran mutanen ƙasa. An yi bayanin cewa an fara samun rigakafi da ake gwadawa, kuma gwamnatin ƙasa tare da umarnin shugaban ƙasa Muhammadu Buhari ana yunkurin yadda za a yi Najeriya ma ta samu wannan rigakafi. To amma kafin rigakafin ya zo, ya kamata ka tabbatar ka kare kanka da iyalanka da sauran mutan ƙasa. Wannan shine zai taimake mu har mu ga bayan wannan. Kwanaki na yi kira ga matasa, har yanzu ina kan yi, a taimaka a rika bin dokoki, kuma a taimaka ma na ƙasa da na sama wajen bin dokoki, kuma a ci gaba da yaɗawa. Yana da ala, yana da muhimmanci. In ba mu yi ba kuwa to akwai matsala. Waɗannan adadin mutane da suke kamuwa za su ci gaba ne, ba ma fatan haka, domin shi kanshi matsala ne wajen tattalin arzikin ƙasa, lafiyar mutane da kuma mutanen ma da suke mutuwa, wanda ba abu bane mai ala ga ƙasa, kowace irin ƙasa ce ma, bare kuma ƙasashen ma da suke ci gaba irin ƙasarmu Najeriya. To jama'a, a yi abin da ya dace. Wanda ya dace ko shi ne sa wannan takunkumin da ake gani, wanke hannu akai-akai, in ba ruwa shafa sinadarin da ke kashe ƙwayoyin cuta, a ba da tazara wajen mu'amala, a guji shiga rintsi taro na mutane da yawa. In ma ba ka da abin yi a waje, kai zamanka a gida. Tafiye-tafiye ma shi ma idan ba ya zama dole ba, ka zauna a gida. Idan muka ba a sannu a hankali, za mu ga bayan wannan cuta. Kar mu bari ta ga bayan mu. Allah ya kiyaye. Mun gode.
Thank you very much, Honorable Minister of Environment. It's now time for us to take some of your questions. I'm sure we are ready to take some of these questions. Okay? Let's call on Friday from Channels Television.
Good evening, honorable ministers and others represented here, my fellow colleagues. I would like to ask just two questions. The first one, I will be glad if the Executive Director, National Primary Healthcare could respond to it. I would like to know, the vaccines that we're expecting, I know that you spoke about it some days ago. Do you have any information whether about their efficacy regarding the new strain of COVID-19? And then the second question, I'll be glad if the national coordinator or the chairman responds to it. It has to do with what is happening with the ongoing registration by the NIMC. Is a big concern to many of us that that could be another breeding ground to spreading this virus. While we encourage state governors to go about shutting down public places and the rest, the government agency is busy with such activity without any strategy to ensure that the virus is curtailed. Are you in talk with NIMC to decide another way to approach this so that we do not spread this virus further? Thank you.
The Chairman, sir, members of the task force, my colleagues, good evening. My name is Nancy Oyedia Orom from MIT. I'd like to direct my two questions to the DG of Primary Health Care. So I want to know, have there been any investigation on how these vaccines can protect someone for how long? Is it 10 years, 20, or for a lifetime? So I would like to know that. And secondly, yesterday, on Monday, when you also mentioned that when this vaccine finally arrived, that there are categories of persons that will be of utmost priority, which is healthcare and others. But there's a category of persons that you mentioned, which is strategic country leadership. I want to know who these categories of persons are. Are they politicians or National Assembly? Thank you.
Good evening all. Rachel, Abuja. My first question is for the ES. Sir, I would like to know what the country now know about reinfection of COVID-19 and herd immunity. Thank you. For the NCDC representative, I don't know if you would like to give Nigerians update on the sorry prevalence survey. My last question is for the chairman task force. Sir, you just said that we'll be having plants in 36 states plus Abuja. I would like to know where this fund will be coming from, because I believe it's not part of the 2020-21 budget. Thank you very much.
Thank you. Just have limited questions today. I think mainly we would start with the Executive Director of Primary Health Care. You may have the floor, sir.
Thank you, Mr. Chairman, distinguished ladies and gentlemen. Good evening. The first question was from channels around the efficacy of the vaccine against the new strains of COVID-19. Right now, we do not have any studies that have shown the level of efficacy of the vaccines against the new strains. One thing that we're sure of is that the Pfizer vaccine is about 95% efficacious. We should be mindful of the fact that in Nigeria, we're still searching for evidence of the new strain. It is only so far in the UK that we're aware that the predominant strains are the new variants. I also want us not to obsess too much about this new strain, right? What the manufacturers have indicated is that even if there's a need to tweak the vaccine, it's not going to be a major problem in terms of the work that needs to be done to provide a vaccine against these new strains. So, for example, in America, in temperate countries, almost every year, they have to change the type of flu vaccine that is given just because of the rapidity with which mutation occurs with the flu vaccine. So it is something that is happening, but it's a great thing that technology is also advanced enough to be able to produce vaccines in such a short time as to counter whatever new strains are available. The second question was from Nancy. What are the investigation and how long the protection will last? So one thing that we are aware of is that this vaccine is new. So we do not have absolute information around how long it lasts, because the vaccines are just a few months old, right? It's going to be a question of time before we know exactly how long the immunity will last. So this is information that will gradually become more available. In terms of the prioritization, yes, I mentioned that we're prioritizing health workers, and she was curious about what strategic country leadership means. What it means is that, for example, I believe that on Tuesday, I mentioned that I would like to see a situation where Mr. President, the Vice President, the SGF, critical leaders come and take the vaccine in the full glare of the public to demonstrate that this vaccine is safe. So we have to make provisions for those. But even in developed countries, what we've also seen is that apart from the prioritization of health workers, you have to also identify critical leaders that you don't want to be wiped away by the virus, right? So for example, in warfare, if you want to disseminate, you want to destroy your enemies, you look for the specific leaders, right? You look for the captains, you look for the generals, and once you decapitate them, then of course the team, the soldiers become weak. So as much as possible, you also don't want to leave your leaders vulnerable to COVID-19. It doesn't mean that you want to prioritize politicians. That is not correct. I emphasized during the last media briefing that we will prioritize our health workers, because the health workers are the ones that are in direct contact with cases, especially those ones that work in isolation units. In terms of reinfection and herd immunity, there is no shadow of doubt, even from different vaccines that we've used in the past, that it is always better to use the vaccine. For COVID-19, it will take approximately 10 years for you to be able to achieve herd immunity. So you can imagine how many people will have died if you're going to rely on herd immunity. The Swedes tried herd immunity, and I'm sure that if you go through the information that's available, they lost a lot of people because herd immunity just doesn't work. The Americans, touted it, and see what's happening in the US. Herd immunity is not the way to go. The evidence is there that when you use vaccines, you are more likely to quickly attain herd immunity. You are able to protect more people using vaccines. I would like to use this opportunity to once again reiterate what Mr. Chairman mentioned in his address, that we must not give way to the conspiracy theories. We must try to manage the information around the vaccines. Where people do not understand, please reach out to those who are scientists, who are public health experts. All of us here are Nigerians that take the issue of the safety of Nigerians very, very seriously. So please reach out to the Presidential Task Force. We have hotlines at the Federal Ministry of Health, at NPA, CDA, NCDC. We also have call centers where you can call and ask questions. And please, we have set up a Zoom link that will be shared with members of the Presidential Task Force media team, so that we can have an opportunity to answer some of your questions even in greater detail. I'm sure that there are so many other questions that maybe this forum might not provide that opportunity for. So we look forward to getting that comprehensive list of all of you, and then we'll have those discussions in the next couple of days. We want to also assure the media that the Presidential Task Force is working very hard to try and provide information about the vaccines. We are cognizant of the fact that it's not enough to just present the vaccines, but providing information that articulates very clearly that these vaccines have gone through those processes that will assure us of their safety. Working with NAFDAC, no vaccines will be administered to Nigerians without clearance from the regulatory body that is responsible for clearing and certifying these vaccines as safe. These are the same vaccines, this is the same agency that certifies which drugs you take, which foods you take. Any any medication that is not safe for human consumption will not be approved by NAFDAC. The COVID-19 vaccine will not be an exception. Thank you very much.
Sorry, are you saying we don't have the infection of COVID patients in Nigeria?
Sorry, I didn't get that question.
Are you saying we don't have reinfection of COVID-19?
Reinfection of COVID-19? Absolutely. There are instances of where people have been positive, they become negative, and then they get reinfected. So what we are aware of is that the immunity provided by antibodies after the initial infection probably lasts about 3 to 4 months. That's what the data is showing. In some instances, it might be 6 months. So the fact that people get reinfected is just lends credence to the fact that the immunity from the natural immunity is short-lived. This is why, the vaccines are likely to be a better bang for our buck. Thank you.
We now take the representative of the Honorable Minister of State for Health, Dr. Adebipe Adebiyi. No question. Okay. The NCDC rep.
Thank you. I think it's Rachel asked about the seroprevalence survey. Yes, we have conducted in 3 states. 4 states actually, with Lagos inclusive, that's Nasarawa, Abuja, and Enugu. Now we have concluded tests for the we are testing for the serological test. The serological test is currently ongoing, and so that's what is delaying the results for us to get the results. And once that is concluded, we will release the results. We are trying to get some reagents in country for that, and by next week we should be able to get those reagents and conclude on the serological test, and then we'll get the results to you. Thank you.
So I think I've only got one question, but apologies if I missed any, because I was trying to sort out this NIMC issue. Right, so with regards to mass gatherings, whether you are a government entity, whether you are a private sector, our protocol applies across the board. We have been liaising very closely with NIMC. In fact, my phone is probably on fast dial as far as the NIMC DG is concerned. We've spoken to NIMC at least 4 or 5 times, and the chairman has also reached out to their supervising ministry. We know that they have set up a system of booking that schedules customers, and certainly for Abuja this goes until the 23rd of February. The challenge they are having is with crowds that are outside their premises, and that challenge definitely needs to be addressed, and we have been working with them. It is extremely important that we take compliance with the non-pharmaceutical interventions as a collective responsibility, whether we are in government or we are outside government, because it's still a risk across the board to the public. And looking at the numbers we are currently having, even though there are situations where people say that we are threatening, we are not threatening to lock down. We are saying that if these numbers continue to go up and we start having significant deaths, we'll have no option. And if we do not want to lock down, now is the time to make sure that we follow these non-pharmaceutical interventions. Wear a face mask. Keep your distance from people. If you have respiratory symptoms, keep away from the public. And if you are vulnerable, stay at home. The numbers we are seeing now are the sort of numbers that we were afraid of seeing back in March, April. And unfortunately, that's now coming back to us. So we'll continue to work very closely with all agencies of government. We know that agencies of government will continue to be responsible, especially the chief executives, to our protocols and guidelines. And we'll also continue to reach out to state governments to ensure that where there is a risk of crowds, control measures are put in place to stop transmission. Thank you.
Thank you very much, the National Coordinator, Dr. Sani Aliyu. May we now invite once again the Chairman of PTF and SGF to please give your closing remarks. SGF, sir.
I think it's not only the closing remarks. I think there was a question. Was it Rachel that asked the question? With regards to whether we had made budgetary provisions for the provision of oxygen plants across the country. It's there. As a matter of fact, not even in the 2021 budget. It's in the 2020 revised budget. If you check item 38, there's a provision for equipping 10-bed ICU centers across the 36 states of the Federation plus FCT. Sufficient money has been provided for it. When the budget was revised, we knew that oxygen is a critical need with ICU. If you have an ICU facility without oxygen, it's just an ordinary ward. It will become an ordinary U because one of the most important critical facilities that you must have in an ICU, that's why it's called intensive care unit, is oxygen supply. It's very, very important before you even talk about the other gadgets that will support life in case there are failures of the vital elements of patients. So that has been adequately provided for. NIMSI and mass gathering. Well, the first day NIMSI started its program, and I saw what appeared on the news item. I had a conversation with the Honorable Minister of Communications and Digital Economy who supervises NIMSI. And instantly, he told me that they had taken steps, even prior to that, on how the registration processes will run. But you know, the problem we have, it's a major attitudinal problem. Our attitude towards and our response towards demands that have been placed on us to do one thing or the other. We're one in a hurry as a people. We're impatient. We always want to get things quickly fixed. So people will turn up even after NIMSI has issued a press release. As a matter of fact, a copy of it was sent to my WhatsApp page by the minister of the guidelines they had given. If you ask how many people have read that, it's there. But nobody will bother to go and search for the vital information that will help you organize yourself, prioritize when you will turn up for the registration. So it's a major challenge. And I think our appeal to our people is that once a government institution issues a guideline as to what steps you need to take in compliance or in fulfillment of a certain need, read the instructions clearly and understand what steps ought to be taken. My first request to the minister was that the congregation that I see in front of the NIMSI office, by the time all is said and done, they will become super spreader events, and there was no reason why people should gather in such numbers. When I read the guidelines that they had issued, as a matter of fact, you are not supposed to turn up at the office of NIMSI if you had no invitation to go. And they have planned it in such a way that you will be invited, you will be told the date, you will be told the time. And it was so designed in such a way that they would have limited people arriving their facilities at a specific time, get the job of registration done, exit, other people will flow in. We will continue to appeal to Nigerians to abide by those instructions and just comply with them. You go and assemble in front of NIMSI and fill up the place, and in a day, if by their programming they can capture 500, and because of the mass of people that have gathered in the offices of NIMSI, they are unable to capture 100 as against 500. You can see that you are delaying even the processes, you are delaying the timing of the completion of the exercise, and they have given you a time limit. The time limit has been fixed as to when they want to wrap up this whole thing. So I continue to appeal that let's lead the instructions, let's comply with the instructions, let's be orderly. If you are not supposed to turn up in NIMSI office for that purpose, don't bother going. Wait for your turn. If you have difficulties, I think they have given a lot of help lines for people to get in touch with them. We are at a very, very critical moment now in our national response. And we need the support of everybody to be able to navigate the picture of what at the PTF we see. I had mentioned here consistently that by the time we get into January, we will begin to see the effects of our conduct and our actions during the festivity times. And this is what is beginning to become an obvious picture. Like the Minister of Environment said, our figures have doubled today. Double the peak of the first wave. It's not going to stop there, I'll be honest with you. The effects of the New Year, the December celebrations will begin to manifest probably the second or the third week of January. And the figures are going to be large. Right now what we have, as a matter of fact, testing is still very, very, very low in a lot of states. If we can get the states to begin to test as aggressively as they tested before, with our test positivity rate that we see about 16 infections out of 100 tests, the number would not be 1,500, 1,600. We'll be counting them in thousands or multiple of thousands. So what do we do as a people? And that's my appeal. Through the medium of the fourth estem of the our appeal to you is that we must be very aggressive with our communication now, because we are at a tipping point. Because the more people are infected, the rate of hospitalization will go up. So we'll run out of bed space. And correspondingly, what will happen is that people who have other ailments will not be able to access care. So people will be dying of COVID-19, people will be dying of other comorbidities and other ailments that they are suffering from. There will be a strain on the medical personnel. Right now, our medical frontliners are under intense pressure to meet the needs of patients who are infected with COVID-19. So we are at a tipping point. My appeal to Nigerians is that we must arrest this transmission, and that's why we are looking at the developing health regulations, which will be of universal application across all states. And we will convince the states today at our meeting that it must be backed up by enforcement through their local regulations or authorizations. It is very, very important. Like the national coordinator rightly observed, that we are trying to balance life and livelihood. In doing that, there must be a juggling that must take place. Which is the best option? What do we need to put in place? So we are working around the clock to ensure that at least we're in place with the support of the governors who are the principal officers in their various states to ensure that something drastic is done to arrest this increase or this hike or spike in the numbers that we are seeing. When we had the briefing, the last briefing, which was, I think, on, was it Tuesday or Monday? Tuesday. Our number was 1,000, was it 204 or 304? Just 2 days thereafter, it's 1,664. I don't know what figure we will come back to you with tomorrow. And as the days roll by, the picture I see is that the figures will keep rising. Because it's a it has a direct correlation with the activities of the last couple of weeks. It's science, it's facts. So distinguished ladies and gentlemen, and those of our viewers that are at home, our only and continuous appeal is that let's stay with the MPIs, the non-pharmaceutical interventions, the wearing of masks, social distancing, avoid unnecessary crowd. Avoid unnecessary crowd. If you have no business traveling, don't travel. I've used myself as an example to tell you that I wanted to go home for Christmas, I couldn't. I wanted to go home for New Year, I couldn't. I believe I have a duty to myself and my family to ensure that I have an opportunity of spending more Christmas and more New Years into the future. And the only way I can guarantee that is if I take responsibility for my conduct and for my actions. And individually and collectively as a people, that is what we are appealing to you to do. Thank you, and have a good evening.
Thank you very much, the Chairman. Thank you for the advice you provided. Well, today we started early and we'll soon close. But for our take-home message, please, may I now invite the Permanent Secretary General Services Office, Dr. Nnamdi Morris Berry, for his take-home message.
The Chairman PTF, other members of the Presidential Task Force here, gentlemen of the press, good evening, everybody. First and foremost, I want to appreciate the Chairman, the Secretary to the Government of the Federation for his commitment and dedication in passing very serious messages to Nigerians on this very pandemic. I also want to thank other members of the PTF for their respective roles in ensuring that Nigerians are put on alert as regards this very pandemic. We've been informed and from evidence that the numbers are rising on a daily basis. And what this simply means is that we have a role to play. The whole public, the general public, the media, the subnationals have very critical roles to play to ensure that this scourge is reduced to the barest minimum. And to that extent, we are informed that the highest grade of victims in this scourge are people in the age bracket of 18 and 50. And these are the highly mobile set of the population. And the simple implication is that when this very high mobility grade of people move around to the society and contract this virus, they come back to the elderly ones at home and transmit this. And of course, the elderly ones are highly vulnerable. And what this simply means is that we are, at this point, endangering our parents, our brothers and sisters that are elderly at home. So, the youths, you are advised, please, if you don't have any business moving out of your house, for now, stay with your parents, relax and enjoy your life, because it's only one who is alive that celebrates tomorrow. We've also been told that the vaccine will be around with us, but no one knows exactly the day it's going to happen. But before it comes, we have to remain alive to be able to welcome it and to receive it in good health. Remember that mass gathering is a major source of transmission of this virus. So avoid mass gathering, avoid exposure, avoid contacts, close contacts with people. Last week, 2 days ago, we were told that you should regard everybody you meet on the street, everybody you meet around, as a potential carrier of the virus. And by doing this, you take necessary precautions to avoid contraction of the virus.